Thank you for joining today's conference call with Governor Andrew Cuomo. I will now turn it over to Governor Cuomo. Thank you.
Governor Cuomo, you can call me whatever you like. Just don't call me late for dinner. We have special guests on the phone today who've joined us for this press conference. We have our great Attorney General, Tish James, who's with us. I want to thank her very much. You'll hear from her in a moment. We have President and CEO of the National Urban League, Mark Morial. I still call him Mayor Morial because once a mayor, always a mayor. And the President and CEO of the NAACP, Mr. Derek Johnson, who's been doing great work at a really important time. So it's a true honor to be joined by them. First, let me give you the quick numbers on New York, which are basically status quo, but good. Status quo is good just about now. Today is day 246. We did 148,000 tests. The positivity in the microcluster zones, our red zones, is 3.1. Positivity statewide without the red zones is 1.3. The overall state positivity with the red zones is 1.5. 17 New Yorkers passed away yesterday, and they are in our thoughts and prayers. 1,125 New Yorkers were hospitalized, 259 in ICU, 117 were intubated. New York is has the third lowest positivity rate in the nation. So New Yorkers should be very proud of that. The only states with a lower positivity rate than New York are Maine and Vermont. And their governors are doing very good work. Also, Maine and Vermont tend to be more rural. They tend to be less dense. But New Yorkers should be very proud that we went from the highest positivity rate in the nation, and now we're the third lowest. The fall is difficult for all of us. It's difficult globally. All sorts of countries are closing down again. So we expect an increase in the fall, but it's managing the increase, which is what this is about. I want to make a broader point today, and that's why I have my colleagues with me. COVID has revealed from the very beginning the underlying injustice and inequity in this society. COVID highlighted what we knew, but it raised it to a point where it was obnoxious and blatant. How we have disparities and inequalities. Why was the COVID infection rate so much higher in communities of black and brown people? Because they're healthcare deserts. There were healthcare disparities to begin with. People weren't getting as much regular care. They had underlying issues, underlying illnesses. And COVID, both in the infection rate and the death rate, disproportionately affected the black and brown population. That's from day one. We then went to do testing, and testing was a way to protect people and protect communities. The black and brown communities, even though they had the highest mortality rate and infection rate, received proportionately fewer tests. More testing was done in the wealthier communities. Why? That's where the healthcare infrastructure was. And that's where people had the resources to take the time or the expense of getting the tests. We worked very hard in this state to make sure we were doing testing in lower-income communities, in public housing, etc. But the healthcare infrastructure doesn't exist in those communities, and those communities don't have the relationship with the healthcare infrastructure. We now come to what I think is going to be the most difficult step, vaccinations. I've been working with the White House Coronavirus Task Force. They had a call the day before yesterday. Their main plan for distributing the vaccine is to have private pharmaceutical companies, big pharma will produce it, Johnson & Johnson, Pfizer, Moderna, etc., When the vaccine is approved by the FDA, which I'm sure will be done on an expeditious basis under this president, if not a reckless basis, the military will be responsible for logistically transporting the vaccine to the private provider healthcare network. So they'll distribute it to pharmacy chains, hospitals, doctors' offices, etc. That is the same infrastructure that doesn't exist in the communities we're talking about. It's the same infrastructure that was lacking, that caused the healthcare disparities in the first place, that caused the higher infection rate in the black and brown community, that caused the reduced testing rate in the black and brown community. And now the vaccine, they're going to go back to the same apparatus which you know doesn't work for the black and brown and poorer communities in this country. They have learned nothing from the start, or they understand it and they don't care. In either case, it's repugnant, it's discriminatory, and it's unintelligent for all Americans, because if you've learned one thing, it's that unless everyone is safe, no one is safe. Until everyone receives the vaccine, no one can be out of harm's way. So it's discriminatory, it's unjust, it's unintelligent, and it learns nothing from this past difficult 8 months. They should anticipate the need for special outreach to these communities, fund state governments, fund community-based organizations. The federal government has a relative pittance, $140 million for the nation, for states to actually do distribution, which wouldn't even allow me to duplicate the testing effort that I did. The state government can get into public housing projects and can work with community-based organizations, but we need the resources to do it, and this federal plan doesn't take that into account. With that, let me turn it over to my friend and my colleague and an Attorney General who's been doing extraordinary work, and good thing, because we needed a good Attorney General in this state, you know. Finally, someone say. Tish James.
Thank you. Thank you, Governor Cuomo, and thank all of my colleagues on the call for the opportunity to join you in this very important conversation about the current state of the country's vaccination plan, and thank you for your leadership during this pandemic. As the governor pointed out, the plan put forth by the Trump administration falls woefully short of meeting the urgency of this moment. Today, more than 250,000 Americans have died because of COVID. More than 9.1 million Americans have been infected with the virus, and tens of millions are unemployed because of it. The president has either been too slow to react or flat out wrong at every turn when it comes to dealing with this virus and protecting the people of this nation. As he indicates, we are not turning the corner. The president is wrong about that. We are seeing across this nation second and third waves. He was wrong about masks. He was wrong about social distancing. He was wrong about when this virus would be over. And now he's wrong about what will be one of the government's biggest and most consequential undertakings, the nationwide distribution of a life-saving vaccine. The plan put forward by his administration is inherently flawed and will have a disparate impact on communities of color. And we have all seen the racial fault lines as a result of this pandemic. The core principle of their plan is that it will rely on the same private entities that are responsible for the flu vaccine. First of all, we must consider the logistical challenges. The logistics of distributing a COVID vaccine nationwide are a far larger and more complex undertaking than any annual flu vaccination effort. Secondly, we must also recognize the resource challenge. Billions of dollars have been given to private pharmaceutical companies to develop a vaccine. And yet, how much has the federal government given the states to administer it? Practically nothing. In fact, they are relying on the states using the existing pharmacies, doctors, offices, and private sector to do it all. 40 million doses. Now, here's the problem with all of this. These institutions are part of our healthcare system that for far too long has failed to equitably provide healthcare to communities of color. And what we will see in this nation is a patchwork of healthcare systems trying to administer this vaccination, and unfortunately ignoring far too many communities of color. You might see a big chain pharmacy like CVS or Walgreens every other block in communities in Manhattan, but let's be clear. The neighborhoods where more of our communities of color live do not have this type of access. And that's the core of the federal plan, a system where it will be easy for wealthy people to get vaccinated and make it so much harder for those who are not. New York clearly recognizes that the existing flu vaccination infrastructure is woefully insufficient to be relied upon solely to provide the COVID vaccine fairly, expeditiously, and equitably to all New Yorkers. The audacity of this administration, the Trump administration, to stand by and watch as communities of color in this country have suffered disproportionately from this virus and then turn around and rig the system once again against them is hard to fathom. We will not stand idly by and watch that happen without raising our voices and demanding better of our federal government. I commend Governor Cuomo for raising a giant red flag and saying loud and clear, this is not acceptable. This does not serve our country. A plan like this is truly un-American because it does not serve all of the people. A plan that only works for the rich is un-American. A plan that says to the low-income community, wait your turn, is also un-American. In New York State, we will work tirelessly to provide for our communities, no matter how much money they make or the color of their skin. We are one. And I look forward to working with the governor to ensure all New Yorkers who wish to receive a vaccine will get one safely, effectively, and equitably. And now, allow me to introduce the president and CEO of the National Urban League, and, as was indicated, the former mayor of New Orleans, Mr. Mark Morial.
Thank you very much, Attorney General James. And let me thank Governor Cuomo for convening all of us this morning. And I agree fully with both the governor and the Attorney General. The National Urban League is a historic civil rights organization headquartered in New York, but serving some 300 communities across the nation through a network of 90 affiliates. Our 90 affiliates have over 2,000 employees, and on an annual basis, we serve some 2 million people in a variety of human and social services programs. Right now, I want to add the following thoughts. Any plan that limits vaccine distribution to pharmacies repeats the same mistakes made with testing in the spring. In March, the White House announced a partnership with chain pharmacies to provide testing. A month later, out of 63 that opened, only 8 were in black neighborhoods. This plan to rely on the current healthcare infrastructure, which has not served us well, is thoughtless, it's careless, and it needs to be taken back to the drawing board, and a new plan needs to be designed. Already in the community, there is great concern, there's great resentment, there's great fear that the plan to create a vaccine has been politicized, that politics, an accelerated approval process, an inadequate, if you will, preparation process, inadequate clinical trials, raise the scepter that many Americans, particularly black and brown Americans, believe that the result will not be safe. It adds insult to the injury of this to now confect a plan that will not include community-based providers, be they schools, be they community centers, be they churches, faith-based organizations, small employers. Imagine the power that would come from learning from past mistakes and building a plan and financing it adequately to ensure that all Americans, particularly vulnerable Americans, have access to this vaccine. And a timeline with respect to a plan should have zero to do with an election cycle or political considerations at all. The only consideration should be what is necessary for a safe and effective vaccine. In an op-ed published in USA Today, 8 top FDA officials and doctors pledged that all decisions will continue to be guided by the best of science and be independent of political pressure. The same principle should hold on the distribution plan for this very crucial vaccine. I remember as a child in my hometown of New Orleans standing in line outside of the school in my neighborhood to receive a polio vaccine. Why not learn from what was done in the past? Why not understand the challenges we face with healthcare disparities and design a program and design an approach that ensures that all Americans are going to have fair, equal, and speedy access to the vaccine? The sheer infrastructure of the nation's current hospitals, clinics, and pharmacies is inadequate for a nation of over 300 million people, inadequate for the need to distribute this vaccine to hundreds of millions of people in a short period of time. So I join with the governor, I join with the Attorney General in saying that this plan does not and will not ensure that black communities and brown communities have fair access to this vaccine. The plan should be scrapped. A new, better, more effective plan with adequate financing for state and local governments and community-based organizations should be developed and certainly should be designed. This continued effort to, if you will, politicize the process around COVID has caused tremendous damage to our country over the past 4 years and over the last 8 months. The stakes are high, and in order to serve the public, we need a competent approach that puts the health and safety of our people as a top priority. So I want to applaud the governor and the Attorney General for calling attention to these continued failures, and we stand ready to work and fight and push for a plan that serves the best interests of the American people. So let me at this time introduce my colleague, the President of the NAACP, Derek Johnson.
Thank you, Mark, and thank you, Governor Cuomo, for your leadership in pulling this call together. This administration has forfeited any benefit of the doubt when months of inaction and incompetence has resulted in nearly 250,000 American lives being lost, and the overwhelming number of those individuals have come from the black community. In any introduction of a vaccine plan devoid of the infrastructure we know that is effective within the black community, using the public sector, traditional institutions, and religious-based organizations, is again reinforcing the same incompetence or intentional act to lock out an opportunity for African Americans, and for that matter, the Latino community, and even greater, poor working class whites in far too many communities who have been neglected in the midst of this global pandemic that is still lacking a true federal response. For the NAACP, the level of inequity that we've seen from this administration is additionally reinforced with the current structural barriers and racism that have plagued this nation for decades. In order for this administration, for any administration, for our society to move forward with a level of integrity to ensure that people are put above profit, the real question here is why. Why would an administration, knowing what they should have learned in March, in April, in May, put forth a plan that would simply be insufficient for the American people as a whole? For African Americans, we have seen far too often, quote, race-neutral policy having a disparate impact on our community because how we socialize, where we socialize, and how infrastructures interact with our community have not been taken into consideration. The private sector and the healthcare industry have not put a premium on ensuring that African Americans and other low-wealth communities are cared for. Therefore, we have no reason to believe that this plan, as currently being designed, will provide the necessary support to allow this nation to heal. Let's be clear. No one can tout a healthy economy without a healthy society. And what we are looking at, what we have seen since March, is an administration who knew of this virus, who did nothing to address it, and as a result of that, have allowed our nation to be impacted, both their health and economics. Stock market numbers is not a true indication on the economic health of society. And I can assure you, whether it's urban or rural, Americans are suffering because this administration, their incompetence, their lack of care for people has resulted in our nation being the laughing stock around the globe. Thank you, Governor Cuomo, for your leadership and setting an example of what true governance look like. And I hope, as we continue to walk down this process, that we understand that public policy can heal people or it can kill people. And all of us know that we must choose and consider policymakers who care enough about people to heal them. Thank you.
Beautifully. Powerfully said. And I can't thank you enough for joining me to help resonate this very important message and bring attention to it. Because the vaccine plan, they're talking about having a vaccine in a couple of weeks. So time is very short, so the message is urgent. To members of the press, let's take a couple of questions for the Attorney General, Mr. Johnson, Mr. Morial, on this topic, and then I'll stay on to talk about the numbers, if you have any questions on the case numbers and the positivity rate afterwards. So questions on this topic for Mr. Morial, Mr. Johnson, Attorney General James.
Ladies and gentlemen, if you would like to ask a question, you will need to press star 1 on your telephone keypad. Again, that is star 1 on your telephone keypad. We have a question from the line of Dan Clark from PBS. Your line is open. You may ask your question.
Hi, Governor. Hi, Attorney General, and everybody. Just wondering, since you're on the phone, Tish, is the state considering any litigation to try to force the Trump administration to expand their vaccine plan at this time?
Let me just say that everything is on the table. We will consider all options at this point.
Next question, operator.
Yes, sir. We do have another question from the line of Steve Burns from WCBS 880. Your line is open.
Thanks, and good morning to everyone on the call. Just wanted to see if there were any kind of solutions that are being envisioned here. I know Mayor Morial mentioned community centers, schools, churches. I mean, what does an ideal vaccine implementation plan look like here?
Let me just offer my thinking, and I've been sharing these thoughts for several months privately with whomever will listen. So you want to get maximum points of distribution, and you want to utilize the data that exists, which indicates where the infection rates have been highest, where the most vulnerable communities are, and ensure that a plan makes full utilization of both existing healthcare infrastructure and the broad expanse of community infrastructure that exists in cities, suburbs, and rural areas across the nation. So it's community centers, it's schools, it's faith-based organizations, just to name a few. And with that public and nonprofit infrastructure maximized to its fullest, I'm confident that you can get multiple points of distribution. There's also a logistical common sense element of this. Who wants to create a system that produces long lines everywhere where people are waiting in line? I went to go get a flu shot at CVS last week. There was a line of 15 people, a wait of, an hour. I doubled back and had to go back at another time. So just the sheer common sense of this means that you're going to use the data that exists, and you're going to design a distribution system that takes full advantage of all of the infrastructure out there, physical locations where you can put a doctor, a nurse practitioner, to ensure that it's a clean, healthy, and safe environment in order to be able to administer the COVID vaccine. This is very doable, but the intention has to be there, the understanding has to be there, and the recognition that structural racism, structural inequality in the existing system, is one of the reasons why you've got a disproportionate impact from COVID in both the death rates and the infection rates. So it stands to reason that you should learn and modify and adjust. And I think our voices, I think the medical community, I think many elected officials and community leaders would easily agree with what we're suggesting. Why the White House and the task force would go down a narrow road as they have done is puzzling to me.
Let me just also add that resources are key. And without any resources to each of the respective states, there cannot be a plan. We cannot devise a plan. It is important that we have the necessary resources to establish an infrastructure that will, again, reach out and address the needs within communities of color.
Mr. Johnson, did you have a...
Yes, I just want to add, and I absolutely agree, resources and the data. You have to follow the data. But first, let's depoliticize what should be seen as an issue of national security. We have a U.S. military that's the best in the world with logistics. Allow them to put into a process logistically how to get, using data, the vaccine to the communities that are most susceptible or in danger of the spread. Secondly, with that logistical support, you must fully fund it so that there isn't a question of how or where you're going to get the money to do it. Next, you have to take the profits out of the conversation, take the politics out, take the profits out, and look at this simply as an issue of national security. And then finally, making sure you get closest to the ground. If that means it's the local mayor of a town or a city or the municipality, if it means it's the county commission or supervisor, if it means it's the faith-based community, get as close to the ground using the logistical expertise, recognizing that this is an issue of national security, fully funding it so there isn't a question of who should or who should not get it based on the allocation or the lack thereof of the money, and see this in terms of an outcome-driven activity that's based on the metrics, irregardless of the race or the wealth of the target community.
Yeah, just to follow Mr. Johnson's point, if you follow the metrics and the data, and you went to the communities that had the highest infection rate, you would be going to black and brown communities. If you then prioritized essential workers which you should, you'd be going to black and brown communities. The traditional healthcare network is not the best way to do that. It's also impossibility. Just think about this. Past 8 months, the entire healthcare infrastructure has been focused on doing COVID tests. Hospitals, pharmacies, doctors, everything. We've done in this nation 120 million COVID tests in 8 months. 120 million. We have to do 330 million vaccinations, maybe twice, because it requires 2 dosages. That would be 660 million. It took us 8 months to do 120 million COVID tests, which is just a nasal swab. How long does it take us to do 330 million doses of vaccination with the same infrastructure? General, Mr. Johnson, Mr. Morial, you have any final points you'd like to make, or I'll let you get on with your day?
Just thank you for your leadership, Mr. Governor. I really appreciate it.
Thank you, Governor. Yeah, thank you for your leadership. Thank you for including us today.
No, thank you.
Thanks for leadership.
Mr. Johnson, thank you very much. Mayor Morial, because once a mayor, always a mayor. And Attorney General, God bless you. Thank you for the great work, and thank you for being great colleagues. Thank you.
Thank you. God bless.
Thanks. Bye. On the numbers or anything else they have questions on?
Thank you, sir. Again, everyone, if you would like to ask a question, you will need to press star 1 on your telephone keypad. Again, that is star 1 on your telephone keypad. We have for another question from the line of Zach Fink from NY1. Your line is open. You may ask your question.
Thank you. Hi, Governor. Good afternoon.
How you doing, Mr. Fink? Regards to Spectrum News.
Pretty good, I got to tell you. Let me ask you, I wanted to ask you regarding this John Mulaney monologue last night on Saturday Night Live. Did you hear it? Were you offended by it? Number one. And number two, I wanted to get your take on the New York Mets sale being finalized now that the Wilpons are out of the ownership business. A lot of Met fans are rejoicing, but what say you?
I didn't see the skit, so I can't comment on it. The Mets, I'm a Queens boy, as you know, and the Wilpons, the Mets are not, everybody wants the Mets to play better and have a better season, a more successful season. That goes without saying. But the Wilpons have been great stewards for many, many years. I mean, it's literally generational. And they were great friends to the entire city and to the state and to Queens. So let's keep that all in context. I'm excited about the new ownership. I think Mr. Cohen has said, Mr. Cohen has said that he intends to invest in the team, invest in the stadium. So that's exciting. And I know Mr. Cohen, and I look forward to working with him. One more, operator.
Thank you, sir. We do have another question from the line of Luis Diaz from New York LED. Your line is open.
Good morning, Governor. How are you?
Good. How are you?
Good, good. About the new testing and quarantine rules in contiguous states, yesterday, just as with numerous times in the past, you referenced New Jersey, Connecticut, and Pennsylvania. Yet news outlets appear to be unclear, as am I, about whether that includes Vermont and Massachusetts. Can you please clarify that for everybody?
All contiguous states. I was talking to a New York City outlet, and I said most relevant for your market, if I recall correctly. It's all contiguous states. And let me say this about the travel policy. This is not only first, we had the list basically included almost all the states, when we were done, right? The list made sense when we started with 1 or 2 states. When every state is on the list, by definition, the list defeats its purpose. This approach is science-based. It can actually make it easier and safer to come and go, right? The list method was just a 14-day quarantine, which is hard, is very hard. Not only is it time-consuming, it's very disruptive. This way, test 3 days before you arrive. And by the way, you'd want to take a test anyway if you're about to travel, because if you're positive, you don't want to get on a plane and spread it. And if you're positive, you don't want to be traveling, right? You want to be taking care of yourself. So a test at least 3 days before, and then once you arrive, 3 days, and you test on the 4th. So not only is it safer and easier, it's what you would want to do anyway if you're traveling, right? Before you get on a plane, make sure you're well for your own well-being, and because you're going to be on a commercial flight and you don't want to infect dozens of people. And then once you land, you get off a flight, 3-day quarantine, which I think is reasonable, and then you take a test on the 4th day. So it's simpler, it's less time-consuming, it's safer, it's easier. And we now have the testing capacity that can handle it. That's something that we didn't have early on. On the contiguous states, we do urge that people should not do non-essential travel. You're also going to hear me say this 110 times. I'm worried about Thanksgiving. The spread is coming from small gatherings. It's not like when the virus first started and when we did the contact tracing, we could get it back to relatively isolated locations that were generating dozens of cases. These are relatively small gatherings. They're parties, they're family meals, etc. There's an attitude that since we're all in the same family, we're safe. Since we're good friends who've known each other a long time, that means we're safe. There's no correlation to that in science. I understand the human instinct. It's just not right. It's not correct. You have a Thanksgiving dinner with 7 people. You can still be infected. And Thanksgiving, I understand this has been a long time, and I understand COVID fatigue, and I understand, well, I'm just going to be with my family. I think you're going to see the number increase even more after Thanksgiving. And it's going to be coming into December, when you run into the flu season, etc. And I think we have to double down on the precautions, even though it is Thanksgiving. I understand the symbolism of Thanksgiving. I appreciate the desire to be with family. But I really urge people to think twice this year. But you'll hear me say that again in the coming weeks. Okay, guys, thank you very much. And I'm very glad we got this message out about the vaccination program, because that is upcoming. On the White House Coronavirus Task Force, theoretically, they've been talking about having the vaccine in 2 weeks for the past 8 weeks. But even the more credible people said it could be in the coming weeks. And the point is, the existing healthcare infrastructure is not sufficient. You're not doing a flu vaccine. You only did 120 million COVID tests. How long will it take you to do 330 million vaccinations? And the existing infrastructure does not adequately serve the black and brown community, and that's where you have the highest mortality rate, and that's where you have the highest infection rate, and that's where you have the highest percentage of essential services, essential workers, right? So let's be smart, finally. Thank you very much. Have a good day.